Good morning, everyone. My name is Emily Schlichting. I'm 21 years old, and I live in Lincoln, Nebraska, and I'm a junior at the University of Nebraska. I'm here today because my life has drastically changed for the better thanks to the Affordable Care Act. I'd like to share with you just how that reform has affected my life. Start, I guess, at the beginning, because that would be a good place. Summer before my senior year of high school, when I was 17, I began experiencing a lot of really odd symptoms that my doctors couldn't pinpoint. My symptoms started as open ulcers that would get painfully and dangerously infected. It intensified in the next coming years to include high-grade fevers, swollen joints. I'd get these large calcified lumps on my legs called erythema nodosum, which hurt a lot, and just a lot of other symptoms that never really fit together. And so after about 2 years of visiting multiple specialists, receiving MRIs, CAT scans, topped off by a week-long stay in the hospital my freshman year of college, I was finally diagnosed with Behçet's syndrome, which is a rare autoimmune condition. It's similar to vasculitis. As you might imagine, that's kind of a lot to have dropped on your head, having barely moved out of your parents' house at the age of 18. But despite going through all of that, I consider myself extremely lucky because my parents have amazing health insurance. And my condition, because of that insurance, was completely covered when I got sick. I think something that really needs to be stressed here is that being sick is hard enough in and of itself. You know, like I was 18 years old and all of a sudden I had swollen joints like an 80-year-old man. I was taking medicine that made 2/3 of my hair fall out, and I couldn't go out on the weekends because it hurt to get out of bed and walk to like a party or over to a friend's house. And so I didn't have to worry about where my care was coming from while I was dealing with all of that other stuff because of my parents' insurance. However, when I did start to get my body under control, it became very clear to me that just because I had good health care under my parents' plan didn't mean that I wasn't going to need to worry about where my care was coming from because I was soon to be off that plan. When you're chronically ill, young, and your health care is tied directly to your employment, your job prospects become a lot more limited than you might imagine. Suddenly taking a few years off to work at a nonprofit before I go to graduate or law school was no longer an option because a lot of those jobs don't offer great comprehensive insurance plans. Beyond that, I could never drop off of an insurance plan because if I did, given the condition that I've been diagnosed with, it would have been almost impossible for me to get back on a plan. Paying for my own health care would pretty much bankrupt me. I see regularly 2 rheumatologists, an ophthalmologist, a dermatologist, an internist, and a couple other specialists for my condition because it's very rare and there's no one doctor that specializes in it. Add to that medicine and preventative tests that I have to get all the time, whether it's a blood test for the kidney transplant medicine that I take every morning or just general checkups. It's really expensive. And that's when things are going well. So the passage of the Affordable Care Act has made all of those issues go away for me. The dependent coverage clause has been, it's a godsend. I mean, I can stay on my mother's insurance until I'm 26, which hopefully I won't have to, and I'll be on my own feet and providing myself with insurance, but having that security, I mean, I don't think there are words to describe how important that is. But it gives me buffer time to figure out what career I want to pursue and to work for a couple years to gain experience in that field before I go back to graduate or law school. And having the time to gain that experience is invaluable to me. One of the things that struck me the most is how unfair it felt that I was being pushed into grad school to stay on an insurance plan or, you know, forced to pay a really high COBRA fee or forced to go uncovered and then not ever have insurance because of something that I couldn't control happening to me. I believe that allowing young people to stay on their parents' insurance gives us a new freedom to work towards our goals without being uncovered. But even more important than that is the fact that the Patient's Bill of Rights makes it so that I can't be denied coverage for a disease that I can't control having. And I can't put into words for you how scary it is to think about being 25 and bankrupt and sick. So I'll just let you take my word for it that it's absolutely terrifying. I can tell you over and over how much health reform has positively affected my life. But I'm not the only young American that has been affected by this law. I'm one of millions and millions of young Americans who have been helped by this bill, whether it's through the Dependent Coverage Clause or the Patient's Bill of Rights, or a combination of both, like me. I think a lot of the issue is that healthcare is something that's really easy not to think about when you're young and you're healthy. But eventually, we all get old, and most of us get sick. And when that happens, healthcare matters more than anything else. And I can testify to that because I've lived it. Most people my age don't think about health on a daily basis. And to be honest, I'm kind of jealous of them that they don't have to. But that also means that my generation doesn't fully appreciate just how much this bill works for them. We are one of the first generations that's given access to free lifetime preventative treatments and care that will prevent life-threatening illnesses before they start. And I think that Senator Hengen made a great point. You know, we need to make sure that young Americans know these things are out there, and that's why it is so important that you're holding hearings like this and that groups like Campus Progress and Young Invincibles, who I've worked with, are getting the word out. Because in order for us to win the future, as President Obama so artfully said on Tuesday, we need to have a generation of Americans who are healthy enough to do so. And this legislation makes that a reality. And for those reasons, I'm personally and as a member of this country extremely grateful that it was passed. Thank you.
Thank you very much for a very poignant and presentation and passionate presentation. Thank you for being here.